Have you ever wondered why some people feel chest discomfort that goes away after a little rest, while others collapse within minutes and never wake up again? Are all chest pains the same, or are there silent warning signs that a heart attack is about to strike? The truth is, some chest pains are harmless, but others are the heart's final warning before it stops beating. And the most frightening part is that, on the surface, these two types of pain can look almost identical. So how can someone in their 60s or 70s tell the difference between a deadly warning sign and a pain that simply eases with rest? If one day you feel as if a heavy weight is pressing on your chest, would you know what to do? That's exactly what we're going to explore today, the difference between angina and a heart attack. Understanding this will not only help you protect yourself, but could also save the life of someone you love. Because even a few minutes of delay can cost you the golden opportunity to survive. Don't you want to know how to recognize a heart attack before it's too late? Before we dive deeper, I'd like you to do something simple. If you believe this topic is important and want to see more videos on preventing strokes, heart attacks, and tips for healthy living after 60, hit the subscribe button right now. And if you're watching this, type the number 1 in the comments so I know this information is helpful to you. If you feel it's not clear enough, type 0 because that way I'll know how to explain things in more detail in future videos. So why do some chest pains appear only when we exert ourselves and then disappear, while others are so severe they can bring someone down even at rest? The answer lies in the difference between angina and a heart attack, and that's exactly what we'll uncover in the next part, which you absolutely don't want to miss.
The difference between angina and a heart attack. Have you ever found yourself walking, climbing stairs, or doing some heavy work when suddenly your chest starts to ache, feeling like it's being squeezed, then gradually eases once you sit down to rest? Many older adults have experienced this, and it's often a sign of a condition called angina. Angina occurs when the arteries that supply blood to the heart become narrowed by atherosclerotic plaque, so the blood is not enough to meet the heart's needs during exertion. It's like a road that has narrowed. Cars can still get through, but with the slightest bit of traffic, a jam occurs. That's why when you stop to rest and the demand for blood drops, the pain goes away. It may not sound too dangerous, but have you ever considered that these recurring chest pains are the warning bells of a looming tragedy? In complete contrast, a heart attack happens when one of the coronary arteries becomes totally blocked. At that moment, the blood supply to the heart is cut off, and the heart is essentially suffocating. Patients often describe the feeling as a tight band squeezing around their chest, or as if a massive elephant were pressing down on them. Can you imagine each breath becoming sheer torture with pain that doesn't disappear even with rest and only grows worse with time? I remember a patient, Mr. Richard, a 72-year-old from Texas. He often felt chest tightness while gardening, but every time he rested, it seemed to ease. One morning, however, he woke up with severe chest pain, broke out in a cold sweat, felt nauseous, and noticed numbness in his left arm. He thought it was just fatigue and tried to lie still. Within 20 minutes, he collapsed in front of his wife. If the ambulance hadn't arrived in time, he might not have survived. Mr. Richard's story is why I always stress to patients the small difference between angina and a heart attack can determine life or death. So how can you, as an older adult, distinguish between chest pain that only needs rest and chest pain that signals your heart is about to stop? Which signs must you remember so you'll never mistake one for the other? Let's dive into the specific symptoms of a heart attack in the next part, because this is knowledge that could literally save your life.
Key symptoms of a heart attack. Have you ever felt a crushing weight on your chest, as if someone were squeezing it tightly with both hands, leaving you unable to take a deep breath? For many patients experiencing a heart attack, that pain isn't just pain. It's sheer terror. What makes a heart attack even more dangerous is that the pain rarely stays confined to the chest. It can spread to the jaw, the shoulders, the left arm, and even the back. Many describe it as a tsunami of pain radiating from the chest across the upper body. And do you know what the biggest difference is? This pain doesn't go away when you rest. Instead, it intensifies, often accompanied by nausea, cold sweats, an irregular heartbeat, and an overwhelming sense of fear, as if death itself were closing in. I remember Linda, a 68-year-old grandmother in Florida who adored her grandchildren. One morning, while preparing breakfast, she felt her chest tighten, sweat soaking through her blouse, her trembling hands unable to hold a spoon. She thought a few minutes of rest would help, but the pain only grew worse, spreading into her arm. If her daughter hadn't called 911 in time, Linda might not be here today to hug her grandchildren each night. Do you see how just one delayed decision can steal away a family's most precious moments? The question is, how can you, at the age of 60 or 70, remember these dangerous signs when sudden pain strikes? In the midst of panic, everything becomes blurred, and without preparation, you might miss the golden moment to save your heart. So what is the simple yet life-saving action you must take when you or a loved one experiences these symptoms? And why is calling emergency services immediately so critically important? Let's move into the survival strategies in the next part.
What to do immediately when you suspect a heart attack. When crushing chest pain strikes, accompanied by sweating, nausea, shortness of breath, and a racing, irregular heartbeat, what will you do? Many people choose to lie still, waiting for the pain to pass, or they take a few painkillers on their own. But do you realize that this hesitation has cost thousands of patients their lives every single day? The first and most important thing you must do is call emergency services immediately. In the US, that's 911. Do not try to drive yourself to the hospital because you could collapse on the way. An ambulance not only gets you there faster, but is also equipped with life-saving medications and equipment if your heart stops en route. Think about it. Just a few minutes of delay can mean the difference between life and death. Would you rather wait or act right away? If you have aspirin at home and are not allergic, you can chew one tablet as directed by your doctor. It helps thin the blood and prevents the clot from growing larger. But remember, this is only an initial support measure, never a replacement for calling emergency services. And if you're with a loved one who is experiencing chest pain, do not panic. Call 911 immediately, help them sit or lie in a comfortable position, loosen tight clothing, and never let them walk around. You can save their life with these simple but timely actions. I once witnessed a 74-year-old man suffer a heart attack while on a walk. His wife quickly called 911 instead of trying to help him walk back home. Thanks to her quick thinking, he received timely treatment and was able to return to his family within weeks. Do you see? Modern medicine doesn't always require complex technology. Sometimes it's your timely decision that becomes the key to survival. But did you know that beyond calling for help in time, there are also simple daily habits that can reduce your risk of heart attack and stroke by up to 80%? So what are those habits, and why does aging not have to mean illness? Let's uncover the answers in the final part of today's video. You see, a heart attack is not an instant death sentence if you know how to recognize it early and act quickly. Just one phone call for emergency help, just the decision not to ignore your body's warning signals, can give you another chance to live healthily with your children and grandchildren. And even more importantly, you can reduce your risk of heart attack and stroke by up to 80% with small lifestyle changes. Think about it. Each day you cut back a little on salt, walk for 20 minutes, sleep enough hours, and keep your mind at ease. These simple habits build a strong wall of protection around your heart.
Don't you want to wake up every morning able to make your own cup of tea, step into the garden to feel the sunshine, and smile as your grandchild runs to hug you? Growing older does not mean living with illness. With the right understanding and the right actions, you can absolutely live longer, live healthier, and live happier. The question is, will you wait until your heart cries out before you change, or will you start today to protect yourself and those you love? If you find this information useful, don't forget to hit like and share the video with your friends. Leave a comment below. Have you ever experienced chest pain? And what other topics would you like me to cover in future videos? And most importantly, hit subscribe so you don't miss valuable heart health tips made especially for older adults. In the fight against heart disease, sometimes just a little extra knowledge and preparation is the very first step toward victory. So are you ready to join me on this journey to keep your heart strong and resilient through the years?